Welcome to the office. Hi.
Hi.
Ariana, welcome to the office.
Thank you so much.
How
so
can I
good to
help
meet
you? How can I help you?
Well, I'm here because I have about 6.5 years of chronic pain.
Okay.
Initially kind of started in my cervical region, and over time, since it hasn't been taken care of, it's kind of gone all the way down my body, so I now have symptoms.
What does this mean? Talk to me.
So, yeah, I have symptoms in my shoulder. There's almost kind of like a catching effect, kind of in the scapula.
Okay.
I have a lot of wrist pain, but it's on the dorsal side, so on the back of the wrist.
Okay.
And I constantly have to pop it, almost like I have to release something.
Every day?
Every day, like multiple. I mean, I'd probably say at least 20, 30 times a day.
Okay.
I also have hip and kind of right hip and right groin pain. I feel it whenever I do like internal or external rotation. There's almost like a hitching going on in the hip.
Okay.
I also have like medial right knee pain and then lateral right ankle pain. So it's kind of all been one-sided.
All right-sided.
All right-sided, except for the neck, which is both.
Okay, we'll get to the neck in a second.
Yeah.
So, all right-sided.
All right-sided.
Started about 6.5 years ago.
That's right.
What happened 6.5 years ago?
So I went to get treatment
What
by
happened?
provider.
For what?
So I have mild scoliosis,
Okay.
and I was working at a desk job, and
And who told you you had mild scoliosis?
I think it was like a physical from school or something, you know, where they do the bend over.
Did they do any X-rays?
Yes, they did some X-rays.
Okay. So you know you
so
had
I knew.
the mild scoliosis.
Correct.
You had. Okay.
Correct. And it wasn't a big deal for me. Like I didn't really have very much issues with it.
Okay.
But then I was working a desk job, and I was like, I need to figure out a way to just maybe get some exercises to make sure that my back muscles are strengthened. I'm having like the right posture, and I needed just instruction on that.
Okay.
So I went in to see a provider. This provider had mentioned that my left first rib was out, and I was like, I don't want my rib out. I don't want anything out.
Okay.
And I didn't quite know what that meant, but I was like, I just know that I don't want a rib out, so we should fix it.
Okay.
So I wasn't even in there for that. I was there for more kind of scoliosis instruction.
Okay.
And this provider proceeded to do this really intense loading maneuver on my shoulder. So his knee was on the bench, and I put my arm over his knee, and then he like went down on my shoulder.
So you had your left shoulder adjusted?
That's right.
Left first rib.
Left first rib.
And that was 6.5 years ago.
That was 6.5 years ago.
And then?
And the months after, I would probably say maybe just even a couple of weeks after, I couldn't turn my neck. So I would have to turn my torso in order to look to the side.
Okay.
And then I was feeling the right wrist pain. So the initial kind of symptoms was the kind of the limitation of the range of motion of my neck, and then kind of this nagging wrist pain.
Okay.
So I would go in to see my primary and say, hey, like I have this neck issue, I have a wrist issue. It kind of came out of nowhere. And I initially thought, I'm stressed out, I work a full-time job, I'm also going to school at night, and I was like, this is just stress. Stress does crazy things to your body. And I didn't necessarily put two and two together because the adjustment was here, and I was like, why am I feeling symptoms here? And
Okay.
so it was just very confusing to me. And life kind of happened, and I got busy, and I just kind of worked through it. And
Well,
just
you didn't
ignored
work
the pain.
through it. You ignored
I
it.
ignored it.
Okay.
Yeah, you're right.
If you worked through it, you would have been fixed.
Absolutely. Well, I
Okay.
tried to get some treatments, and I mean, everything kind of.
But
was
did
put
anyone
on
tell you
hold.
what's going on with all of this?
No, I've seen like physical therapists, occupational therapists, acupuncturists, massage therapists, and I haven't really had. Everybody has kind of said you have tight muscles, and you've got scoliosis.
And that's your reality.
And that's my reality.
And
correct.
what are you supposed to do?
I guess manage it with pain medication, icing, like stretching, that type of stuff. But it is so persistent in my life. I honestly don't even know what it feels like to not have pain. I can't recall because I'm constantly at a level of pain, and
Okay.
and Yeah,
Now you're here.
and now I'm here.
Why now? Why here? Why now?
Why now? I knew you were gonna ask me that question.
Well, here's the thing. You're coming from up north,
Yeah,
right?
no,
So
exactly.
you took the week off
Yeah.
to come here. It's a big deal.
Absolutely.
You know, it's time, money, energy, all that stuff.
Absolutely.
Right? You have to
Yeah.
leave everything behind, and you
Yeah.
have to just take a leap of faith and say, "All right, let's do this."
Absolutely. And
So
I
why
think
now?
that you hit it on the head. I have been praying for so long for some sort of relief, and I think I'm just over the pain being my narrative for so long.
God, okay.
And you
Yeah.
know, whether it's like I can't do this because I'm afraid I'm gonna get injured, or even the way that I have in my relationship with my personal relationships, I feel like I'm not bringing my best self because I'm constantly like, I'm tired, I'm in pain, I'm constantly complaining.
You limited yourself.
I've limited myself, and
Okay.
even I'm so proud and thankful for the fact that I've been able to kind of like suffer through and do the things I have accomplish the things I have accomplished.
Yeah.
But I'm like, there's almost like, what can I do if I didn't have pain? Like if I wasn't limited by it. And there's just curiosity, there's a longing, there's like this hope that, you know, I can maybe even have a family in the future and not be
If you want to.
pain-free
If you
if
want
that's in the cards for me. And
Sure.
there's so many things that I feel like I don't want to do because I'm afraid. And I don't want to live out of fear, you know. I don't want that to be. I'm just over the fear and the pain narrative, and I'm just ready to be like, okay, I want just a new lease on life. And so I'm here for answers, and I'm hoping that I can get some answers and maybe
And
a
hopefully
little
some
relief.
relief.
Yeah.
Okay.
yeah,
And what do we do here? We're not here treating all your symptoms.
absolutely, yeah,
I'm here to help you discover first
Yeah.
what's out of balance.
correct,
You've watched my videos, you know how I work.
absolutely,
We're
yeah,
gonna go over your x-rays, we're gonna
Yeah.
look at your structure
mm-hmm.
and try to get some answers today.
Mm-hmm.
And we'll look at this, you're saying scoliosis. We'll talk about all this stuff, okay?
Okay,
And
perfect,
questions along the way, just ask.
awesome.
If you're
I haven't
uncomfortable with
done-
anything, just tell me to stop.
Okay, I
Okay?
will. Awesome.
Are we ready?
I'm so ready.
Let's do this. Mariana, let's go over your x-rays.
Mhm.
We're going to be going over your AP, which is the anterior posterior, looking at you from behind. This is the right side. This
Yeah.
is the left side. I will be zooming in and out along the way.
Okay.
Then we'll go over your lateral film, which is looking at you from the side, okay?
Mm-hmm.
And let's start with this. And the first thing is, you've heard me talk about this, but I'll just review the basics. 24 bones in the spine, 23 discs in between. This is the foundation of this 24-story building. Think of your spine as a 24-story building. The foundation of your building is the sacrum and the pelvis. In order to have a stable building, we need a level base and foundation. And my job here, Mariana, is this, you know, and we're looking at yours. Do you have You actually don't have scoliosis. It's something else.
Oh.
Now, the first thing is we want to make sure we have a level base and foundation, correct? Second thing is we want to make sure is the body balanced. And this is what life is about. It's about symmetry and balance. We want to keep it simple. People will come in with all these symptoms.
Yeah.
You know, one nerve can cause 100 symptoms.
Yeah.
So it's not a matter of, hey, let's just start chasing all these different symptoms.
Right.
Let's get into balance.
To the root. Yeah.
To the root.
Correct.
Now, we do have some curvature issue here, yes. We will look closer to see, meaning there's a kink here.
Yeah. Yeah.
It's not doing this, okay?
Uh-huh.
There is we're going to go closer, but
Yeah.
let's look at it, okay? Let's look
Okay.
at the foundation. Let's go a little closer. So there is a slight little curvature thing going on there, right?
Uh-huh.
Okay, and let's get closer. Let's look and see what it is. First thing, just looking at it before we look at the numbers, does this look symmetrical and balanced? No. This hole looks different from that hole. This width looks different from that width, correct? We have a bend. You had a couple of good falls there in the tailbone, but it kinks like this.
Yeah.
And you can see right here is where it bends that way,
Yeah.
right? But then you can also see right here it bends this way. So we have two different things. You've had a couple of falls, that you have. And I believe that's what started a lot of this process.
I see.
Let's go on the lateral. We'll come back to that in a second. And let's see what happened here. So when we're looking here, you can see We need a nice smooth tailbone, you've heard me talk about.
Yeah.
Do we have that? No. We have this nub, we have this nub, and then your coccyx is open in the back there. So we have a coccyx issue, we have 3 sacral segments. The question is, I'm assuming, okay, it's a big assumption, to have 2, 3 sacral segments out like that, you probably had your initial injury very early on, and your body was compensating a lot.
Got it.
Okay, you grew up, you moved around quite a bit.
Yes, yeah,
Yeah.
that is
So
true.
there wasn't really like I'm sleeping, I have a routine.
Right.
Does that make sense?
That's right.
And I think routine for kids is so important.
Right.
Okay, so we have a coccyx issue. We have 1, 2, possibly 3 sacral segments. Does it mean I'm doing all? I've done them in some cases.
Yeah.
I don't know that that's your case right now, but I do
Yeah.
know we need to start somewhere down here in the foundation.
Right. Okay.
Would I start in the coccyx? No. Let's get the sacrum stabilized,
And
then
then
we'll
check
deal
it.
with that.
Mhm.
Okay?
Okay. Sounds good.
We'll check for pain and tenderness pre and post sacral work, okay, just so you see the difference.
Right.
Okay?
Sounds perfect.
Once the sacrum is stable, then we got to deal with your L5.
All
Okay,
that yeah.
all that. But here's what I want you to see. L5 tilts back. It's very subtle. Your disc is good, by the way.
Yeah, I was going to say.
L4 tilts also, right?
Uh-huh.
And then 3 compensates, 2 compensates, 1 compensates, and then 12 is level. Do you see that?
Yeah,
12
I
is a
do.
level disc.
Yeah.
They should be level discs. The shape of the curve on the lateral film, and I can use these words and all that fun stuff.
I love it. No.
So
please.
the curvature in the lateral X-ray, the lateral spine, comes from the shape of the bone, not the disc. The discs are designed to be level and parallel.
So when you're saying that they're equal, are you looking?
Like
You're looking between.
I'm
and
looking
the
here.
distance.
Yes.
Okay, got it. Yeah.
So this is an X-ray.
Yeah.
It tells it we're inferring spaces.
Correct. Yes.
And we're looking at distortions.
Yeah,
Right. We're
yeah.
looking at X-ray projections and distortions.
Right.
Okay.
Okay, got
And
it.
I'm looking at this. So in the lumbar spine, the discs will be anatomically larger,
Little bit larger.
in the lumbar
Correct.
and the cervical.
Okay.
Now, the way they misalign, this is important. The way the vertebrae misalign on the cervical and lumbar, they go back and tilt. But in the thoracic, they go up. It's very different.
Back and tilt.
So when we're looking at the thoracics, we're looking for it to open in the back. Okay?
It's natural to have.
No, there should be level.
I see.
So this is level. This is a little swollen, but it's not open in the back.
I see what you're saying.
Okay?
So that's still good.
That they're all good.
Okay.
None
good.
of these are all compensating.
Yeah.
This one starts to open in the back.
Yeah.
Check it out. Can you see this line here?
Yes, I do.
This is closed in the front, open in the back. Do you see that?
I do.
That's this one. And this is 7,
like
1,
T.
2, 3, 4, 3, 4 area.
T.
And that's that hard kink.
Yeah.
And 3, 4 is heart and lung. Nerve supply, okay?
Yeah.
All right. Cervical discs are good. They're
Yeah.
hypermobile.
Yes.
They're compensating. You see when we're looking at this,
Yeah.
we're looking at those under surfaces under the bone. But in a neutral position, 2, 3, your third cervical kicks back. 3, 4, 5, diaphragm alive. That's the diaphragm, the breathing mechanism. Now, if we go into flexion extension, let's see if there's any change. So if we go into, okay, that's your extension. No, that's your,
There's flexion. That's
okay,
extension.
there's extension. So in extension, I'm assuming it's a little harder to breathe in extension. We'll test it out for you. 3 goes back, 2 goes back. So there's hypermobility up in this part of the neck, and those muscles are getting tight only to compensate.
Yeah.
And we want to just briefly talk about the muscles when we're done here. I want to explain my philosophy on it, and when I'm looking at structure. So there are 5 defense mechanisms, okay, that the body has to protect the nervous system at all costs. Number 1 is your spinal curve. Number 2 is the muscular system. Number 3 is the ligament. Number 4 is disc or the disc. Number 5 is calcium and bone. I have a video that goes through the whole defenses of the body.
Yeah.
Okay?
Okay.
Dr. Rahim Chiropractic 101. Why that's important, you've lost curvature, so these muscles are working
Extra
overtime
hard.
just to keep you upright.
Right,
So
right,
your
right.
basal metabolic rate and expenditure of energy just
It's
at
so
rest
much
is
more.
high.
Absolutely.
So you're tired just sitting.
Yes.
Okay? You're
People
tired.
don't get it.
You're tired of sitting.
Yeah.
You like
no,
to
they
stand.
get
You like to
it.
move.
Yes,
If
absolutely.
you're sitting, you're getting it hurts.
No,
Okay.
yeah, it does. It
All
does.
right.
I
Does
hate
that make
sitting.
sense so far?
Absolutely.
Okay.
Yes.
So in flexion, this is where we get some answers. They should all move forward. That moved forward, that moved forward, that moved, that moved, that moved. Your neck is all compensating, ma'am. Your answer is not in your neck.
Huh.
Okay?
Oh my gosh, and that's where all of my pain is.
But that's not what
It's so
it
misleading.
is.
Yeah, absolutely.
Okay.
Makes sense.
All right.
Everything's foundation.
Can I continue?
Oh, yes, please.
All right, let's look at the foundation. Now, let's look at the numbers of the foundation. Do we have a level foundation? No, we
No.
don't. AS1, EX7 on the left, P4-R rotated sacrum on the right, sacral malformation, 2 millimeters dropped on the right. Measured difference is 3 millimeters, meaning your right leg is 3 millimeters below your left.
Yeah.
Anything under 7 millimeters, adjustments will hold.
Good.
Here's now some of the answer. You have a rotated sacrum on the right. Whenever I see an inferiority of a sacrum, if the bone is not malformed or developed normally, it's usually due to someone fell on their tailbone caused it. In your case, I said you've had multiple tailbone injuries growing up, wherever that was. Now, here's the kicker. EX7, your left pelvis came after your tailbone, and here's why I say that. When we look at it, it's doing this. AS1 goes up 1, but then it externally rotates out 7. So you're favoring the right with a short leg on the right, but your curve is going left.
Oh my gosh.
That's not scoliosis. This was trauma. Okay?
Wow. Okay.
So this goes out, right sacrum comes back, everything is favoring the right side down to the right.
Yeah.
Now let's look at this, okay? Is this scoliosis? So what happens is you actually have also what's called a special listing at L5, PRS-M. I'm just saying that out loud. These are all things that tell me trauma, okay? That's why I'm saying that. Okay. Now, so we have a slight little curve right here, but then what the heck happened at third lumbar that juts the spine all the way to that right side? 5-4, third lumbar juts, but remember, the one that looks the worst is usually not the cause.
Yeah.
Okay, and then, but we can see a hard kink here. And then it goes, and then it turns. But then it doesn't level off, it kinks back the other way.
Yeah.
Okay, and then it goes, and then it kind of levels off right about there.
Yeah.
And then 1, 2, 3, 4, T4.
It's a crazy highway.
Okay? T4 is causing all your neck stuff. I ain't touching anything above your T4.
Okay.
At least not for the first 1 or 2 adjustments.
Okay.
If we have something up in the upper cervical,
That
we'll
shows
deal
up.
with it.
Yeah.
We got the basement, we got the penthouse. All the other stuff we need to tune up, we'll deal with along the way, but we need somewhere to start.
Yeah.
Because you've had all that stuff done, we have to kind of...
Yeah. It's like an onion. We
we gotta peel that onion. You ready for me?
I am so ready for this.
You have questions on this?
No.
So going back to this, we said swelling of the sacrum. You can see that the right scapula is lower, more pronounced, more swelling. Then she gets more swelling in the upper, and this is where that kink here is. And then just come right behind me, Shasha. Look, it does this. And look at her neck. You can see one side is higher, one side is lower. This ear looks bigger than this ear. It's not, it's just the way it's sitting, so it's projecting differently, okay? Now let's see the walk. You coming up from Santa Cruz. Walk to the nervous system poster. There's the catwalk. Walk it out several times, please. And we want to make sure those dimples are moving up and down. And your dimples are actually moving.
Like
that's the good
appropriately?
news. Yeah, they're moving.
Good.
They are moving.
They're
The
not
left
stuck.
side does not come down as much as the right side. Keep walking, please. And you can see she's compensated quite a bit. Ah, keep walking.
Uh-oh.
How long have you walked on the outsides of your feet?
Oh my gosh. It's true, when my shoes wear out, they're always on the...
Well, how long? As long as you can remember?
I think so.
Okay, so guys, this is something else now. There's something else that happened. Whenever someone walks on the outside of their feet, now this is important, okay, let me explain this. So when we're walking, when we see someone walk more on the outsides of the feet, this is an upper cervical.
Oh.
Way up top. That's the body innately trying to balance itself.
I see.
If this was just a sacrum issue,
Yeah.
then it's more the pronation, which
Yes.
you do have that also.
Right.
But that's a compensation because
From the
you're
external.
supinating too much from the supination.
Uh-huh.
Okay, so this is important. Keep walking. So we are probably going to find something up in the penthouse.
I do. I think I might have something in the atlas.
Okay, walk on your toes now, please, for me. You're wearing heels?
No, it's too uncomfortable right now.
But you prefer the heels?
No.
Okay, her left calf is more pronounced, her right calf is less pronounced. Keep walking. Regular walking back towards me. She has a lot of swelling in her body. Stop right there, march in place. Stop for a second. So just looking at her, look from behind. The left knee looks higher. Relax the knees. Try not to engage anything if you can. The left knee looks higher. The right knee looks lower. I need to take a measuring tape because your right thigh looks thinner. I need to check something out, and this may be part of the answer.
Heyo.
Step back for a second, please.
Okay.
So when I'm looking here, turn this way.
Mm-hmm.
The right side, march in place, and stop. The right leg looks thinner than the left leg to me. ¿Entiendes?
Mm-hmm.
Sí.
Entiendo, señor.
Entiendes. So let's look at this one. This is 16 and just a little shy. Hold on. I'm going to be on there. 17, just a little shy of 17.
Okay. What do you guess? 18. 17.5.
Done it.
Oh, 17 point.
17 and
A quarter?
between a quarter and a half. So this is thicker. So what does that really mean? There's
I've
another
been doing
answer.
one squats on my left leg. No, I'm kidding.
Where does the muscle get its information from? The
nerves.
nerve.
Mm-hmm.
So when we see one side, there's two things. Either we have an obstruction somewhere on the left side that's causing the swelling, or number two, there's nerve pressure going down that's causing less tone of the right leg.
Got it.
Okay, it's one or the other.
I see.
Could be both.
Okay.
But that's a good finding. Okay, it's really important. Walk for me back and forth, please. So from just her gait walk, we discovered a couple of things and the visualization, right? Number one is we discovered that there's swelling in the sacrum. The right leg is thinner. She supinates. Now let's go ahead and scope and see what we find, starting at the base of the neck. And the first thing we're getting is 20 points.
Oh gosh. But it's 20 points downstairs too.
But
Over
then it
here.
switches and it goes to 15 on the right. Huh. And now it switches to 18 on the right. It's that balance between the right and left side, yo. All right. Now, we have to make sure when we're scoping, we're following the scope is in the center. And because of this curvature, I'm just marking it. Okay, so we can see. And we follow the contour of the spine, otherwise we could get a false reading. And there's your T4.
So good, Dr.
10 points.
Called it.
T4 up top, C1 maybe occiput, All right, so ladies think this is back fat. It's not back fat. It's just swelling.
All together now.
All right, now.
I'm guessing 20 points on the right.
No.
This is like the Price is Right. Like, I'm gonna give myself. You can't go over.
The spine.
Okay, so.
Okay, we have 10 points down low.
Really?
In the S3, S4.
On the
Left.
On the left. Oh, wow. I thought it was on the right.
Yeah, that's where it started.
Mm-hmm.
S3, S4, T4, C1 occiput. Next thing we want to do, static palpation. Round your back slowly, please. Good. All right, static palpation. You can see the swelling right there, and it sucks in right there. 7, 1, 2, 3.
Oh.
4.
Woo.
All of this is swelling. This is all boggy tissues. Boggy, boggy, boggy. And then watch here. You can see, I don't see the dimples. So hopefully by the end of this week or sooner, you're going to have your dimples. But look, watch. Look at my fingers. All that swelling pulls up on her left side. Look at that. And it goes where? It bypasses the rotated sacrum and it goes right down there.
Ooh.
There. So first one we said was T4. Spicy.
Super spicy. That's like a
Spicy.
4 out of 5
Right.
spice level.
Now let's look at the tailbone and see which one it is. You're good over there. 1, 2, all the way back. Number 5. S1.
Oof, that one's
Tender. S2.
oh, tender
Tender.
down.
S3.
Very
Tender.
tender.
S4. A little bit.
Yeah. Oh.
S5.
Oh my gosh, I'm working out.
I'm moving this over. I'm on here, your coccyx, okay?
Uh-huh. It's all tender in the sacrum.
That's coccyx.
Yeah.
It's starting at 5, yo. S5. Okay, T4, S5. Let's check the neck. Giggity, giggity.
I'm so excited.
Sit back for me. Look up all the way in extension. Down all the way in flexion. Look straight. Turn left. Turn right. Look up at the ceiling. This is divorce test, isolating the lower cervical. Left side, right side. It's not your neck, dude. Down. That's upper cervical.
Yeah.
Tight.
Oof.
Yeah. It's starting up here. Right there.
Yeah.
Yep.
Right there.
Primary motion of atlas is rotation. Primary motion of the occiput
Occiput is
is
up and down.
nodding.
Yeah.
Left side is good.
Well, there's one.
That's hypermobile.
I know.
Right, that was the ligament. There was
Yeah,
that
no,
was
I
not
know.
an
I do that all the.
adjustment.
I know it's the popping of the.
Right atlas,
Yeah.
S5, T4.
S5.
But I think in your case, I'm going to do it actually different, guys. You know why?
You're switching it up. How come?
We have to do your T4 first.
Okay.
You need to open your heart.
Okay. I want my heart opened. Ready.
Okay, so we're going to do T4.
Okay.
Then I'm going to have you get up, and we're going to do S5 over here first.
Okay.
After that, I'll have you walk. I'll retest.
Okay.
We'll see if I still need to do the atlas today or not.
Okay.
Okay, I thought penthouse basement.
Yeah. No.
We've got to open the heart first.
Sounds good.
Okay?
Let's open the heart.
Let's do it. Whatever you need to do, you do. Okay, guys. T4.
That's it.
T4.
That's the money.
T4 sacrum. We're going to set S5 as a PR sacrum S5 though. And then for T4, 1, 2, 3, 4. T4, we're going to set it as a PRI-T. PRI-T.
PRI-T. Boom.
Let's go face down over here. Let's get started.
Alrighty.
T4, PRI.
I'm excited to be able to breathe.
So PRI-T means we're going to be on the left transverse. There's 7. 1, 2, 3. Look, it's still red and swollen. T4.
Do I need to brace myself?
No, ma'am.
Okay.
I need you to
Okay.
relax.
Okay.
I need you to breathe and receive.
Okay, I'm here for
Are
it.
you okay to breathe there? Now we take all that tissue out of the way. We're right on that. T4. Good. Good. Home run. Oh, good. Let's get a little more on the spinous now. Good. There's the rest. Not so bad. Now, just from that, Mariana, come off slowly. Hold my hand, please. And let's walk it off once. Breathe. Don't forget to breathe. Face down. Slide up. Well, we did talk about sacral malformation. There's a lot of scar tissue there.
Yeah.
We're going to do it here then.
Okay.
There we go. And chin up, please. Shoulders down, down. Okay. Nice and easy. We're just prepping, okay?
Okay.
Relax the shoulders, please. I'm going slightly on that right. Are you good?
I'm so good.
Receive. Good. Home run. That's the 4, 3, 2, 1. Beautiful.
Like the flick. Flick it off.
Did you, that moved. That moved nice. Now, check it out. Hi. You holding someone else, baby? Hold my hand. Come off the table. Walk it out. Walk it out. Please walk it out. Walk 3 times back and forth, and then we'll continue.
Okay.
Just from that, tell me if anything is different. Let me see the back, please.
Yeah.
Walk, please.
Okay. It feels more open.
There's more movement actually in your tailbone.
Yeah, I feel it.
Watch here, please.
Like I feel like there's more motion on the left.
Keep walking. Walk on your toes, please. Yep.
It feels like there's like more movement, which is more than I've felt in I don't even know how long.
Walk on your heels, please. Good. Very nice. Have a seat. Let's rescope. Different now. Should be different to sit.
Yeah. It used to be so uncomfortable to sit straight.
That cleared your neck, 0.
No way.
Yes,
oh my gosh.
T4.
That is insane.
T4. Oh, you can go back to the video, okay? Everything is clear up top. 0.
That is
No
so
chatter.
crazy. Wow, so it was all in the T4 and
It's all in the heart.
wow.
Mira.
Oh my gosh.
Mira. Mm-hmm.
That's so wild.
I got it a bit more down low. Go right side down, please. Over here, right side down.
Okay.
There.
Uh-huh.
Now. Okay, we're going to do that. Involve side down. Easy, easy, easy. Is that okay on your shoulder? Let it roll, please. Gotcha.
Woo!
Gotcha.
Home run.
That's your home run, lady. Stand up, walk it out, please. Walk it out once, please. That should be even more. Regular walking. Muy bueno. And have a seat when you're ready. Just walk. Hi!
Hello!
Hello.
New me.
Look at the swelling in her tailbone, and now the dimples are starting to come alive.
There they are.
There they are. Head down. 0, dude.
That is
look
insane.
down, turn left. Look down, turn right. Check it out.
Oh my gosh.
Do you remember?
Do you remember the time?
Do you remember? Try that again, please. That's clear. Look up, turn left. Turn right.
That is
Look down.
insane.
Look, we didn't touch it. Okay, so
Wow.
I'm sure you could probably make some pop sounds up there.
Yeah,
But
that's
that
all
wasn't
organic
the fix.
stuff.
That
Yeah.
wasn't the fix.
Wow, it all was in the T4.
Okay, can I continue?
Yes, please.
Let's check the shoulders.
Okay. Oh yeah.
Easy. Drop it down,
Uh-huh.
down, there. Let me do the work.
That's not easy for me.
No worries. Let's do it this way. That's it. On your back, please. Listen, because you went through that stuff, I'm not trying to go crazy on the shoulders and
Yeah,
all that right
no,
now.
for sure. Okay.
All of this is secondary to the spine. Whoosh, whoosh.
How does it look?
I mean, cute.
I know!
There we go. Sasha?
Sasha, you know you like it. She's having fun too.
Sasha's always having
She
fun.
is. Sasha's the best.
Yeah, look. 16 and a half.
So wild.
17.
That is
Do
insane.
me a favor next time, just to be sure.
Yeah.
We did switch. Your shorts
Uh huh.
that don't have the
The
tightness.
band.
Yep.
Oof, okay, I'll see if I can find
No
some.
worries. All good. Let's do the ankle now.
Oh, I'm so excited for the ankle too. This is.
Right side.
Oh. That's spicy too.
What?
That's
That's
spicy
spicy?
too.
So let's work out some of the swelling. Whenever we're working on the ankle, we want to work out periarticular swelling,
Uh-huh.
which is just working effleuraging towards the heart,
Uh-huh.
right? This is effleurage, right?
Effleurage.
And you can feel that nub there.
Mhm.
That's a nasty little nub there.
Yes.
5, 4, go.
Do I have like an anterior superior?
AS talus, yes.
Talus,
And
yeah.
that's what we're going to work on.
Yeah.
But because of what we did with your tailbone,
Yeah.
we're going to use the board to start, okay?
Okay. Sounds good.
5, 4, 3, 2, 1. Passive range of motion. 5, 4, 3, 2, and 1. All right. Raise your right leg, please. AS talus, medial tilt. Got it. Posterior fib. Nice. Now feet together, slide down so your feet are hanging off the edge.
I've always wondered what that felt like.
Well, what did it feel like?
It felt like a good adjustment to me.
Bring your toes back as far as you can. They're even.
It used to be super limited on the right.
Turn to the left side, please. On your side. We're doing the heel, bend the top knee.
Okay.
Heel, calcaneus, posterior lateral. On your back, please. Actually, on your right side, sorry.
This is like.
All right, now navicular, bend the bottom knee.
Uh-huh.
There you go.
Ooh.
Hi.
Hi.
Walk it out, check it out.
Oh, I love it.
Now, as you're walking, regular walking,
Okay.
just tell us if anything is different. Good, bad, ugly.
Never.
Give it a minute.
Yeah.
Little weird,
It
right?
feels so different because I felt like this is been like locked up, the right angle. I also feel like I'm not tempted to walk on the outside. Like I'm not doing that anymore.
Just walk. Don't think about it.
I'm not gonna think about it. I'm not gonna think
Jessica,
about
you
it.
can even look at her feet.
Mm-hmm.
What's gonna be cool is after today's walk.
You want me to? You
Yeah,
want me to
your
walk
homework
a time?
is 12,000 steps.
12,000. Okay, got it.
Water and icing, okay? I will give you some enzymes for some inflammation.
Okay.
I don't wanna deal with anything else until our next visit. We see how you did with all that.
Okay.
Okay,
sounds
let's
good.
check, but I will check hands. Come
Okay.
over here, please. So, we did S5,
Mhm.
we did T4,
T4.
we did talus,
Uh-huh.
we did shoulder.
I have something off in my wrist.
Yes,
My
ma'am.
scaphoid, I think,
Squeeze,
or lunate.
squeeze, squeeze. It's actually starting in the posterior humerus.
Okay.
Okay.
Sure. I'm
One
not
more.
surprised.
There. Check it out now. Squeeze.
Okay.
Radial head. Your wrists are coming from your elbows. I'm
Makes
just saying.
sense.
A little more.
There it is.
A little bit.
Ooh.
There. Step.
Hi.
Squeeze.
Yes.
Squeeze. That's where we're going to start. Any questions for today?
No.
Welcome
Thank
to
you
the
so
office.
much.
You're very
Thanks,
welcome.
Dr. Rahim.
You're welcome, my dear. Okay, we have a week.
We do.
We'll go through the journey this week. We'll see what happens.
Awesome.
And just document any changes, good or bad, does not matter.
I will.
Okay?
Okay.
Take care.
Thank you so much.
You're
Thank you,
welcome.
thank you, thank you.
You're welcome.